This article is for informational purposes only. It is not a substitute for professional medical advice, diagnosis or treatment.
Are pregnant women at risk of COVID-19? We know that recent news about coronavirus is disturbing and can cause anxiety. You may have planned to get pregnant this year, and now you are not sure if you should go ahead with the plans or wait a bit. The truth is that there are some important aspects determined by current events, which you must take into account when thinking about expanding your family.
What are the specialists' recommendations? Despite jokes about the next generation of children being conceived by couples around the world who are isolating themselves in their homes, some health professionals are sounding the alarm about the decision to conceive a child during a pandemic. This warning is driven by concerns about overloading the already loaded medical system, a lack of data on how the virus or its treatment affects the fetus in the first and second trimesters of pregnancy, and anxiety about the uncertainty that hospitals will provide adequate care for pregnant women and newborns.
In mid-March, fertility clinics in Canada informed patients that new treatment cycles were being discontinued. They applied the measure after the Canadian Fertility and Andrology Society issued a recommendation to postpone new inseminations, in vitro fertilization and frozen embryo transfers, citing concerns about the possibility of medical care. The only exception would be urgent cases involving cancer patients. The American Society for Reproductive Medicine has issued a similar opinion, and in Europe, the European Society of Reproduction and Human Embryology has warned that all patients who are considering or planning fertility treatments should avoid becoming pregnant at this time. Citing a lack of information on how the new coronavirus, which causes COVID-19, affects early-stage pregnancies.
Should I give up on trying to get pregnant? What we encourage anyone considering the concept of a child during this period is to focus first on what is known. Risks of COVID-19 during pregnancy. According to the World Health Organization, pregnant women do not appear to have a higher risk of COVID-19, and only 1% of infected pregnant women have experienced severe manifestations that require medical attention. It seems that most pregnant women who will be infected with coronavirus will experience only mild or moderate symptoms. In fact, there will even be asymptomatic pregnant women. The probability of having more serious complications is the same as for the rest of the population. However, when it comes to viruses and similar respiratory diseases, pregnant women are generally considered a more at-risk category and, like anyone else, during this time they should wash their hands, not touch their face, stay away from anyone who coughs or has any other symptoms of COVID-19 and practice social distancing.
Transmission of COVID-19 to the fetus. Recently, a Chinese study, based on a very small sample of 9 pregnant women, suggested that COVID-19 is not transmitted to the baby during pregnancy. The virus was not found in amniotic fluid, umbilical cord blood, or postpartum blood in women's breast milk. In other words, what scientists know at the moment suggests that a pregnant woman cannot transmit the virus to the fetus in the womb. Also, according to the U.S. Centers for Disease Control and Prevention, CDC, there does not appear to be an increased risk of miscarriage or stillbirth in pregnant women infected with coronavirus. Based on the limited information available at this time, doctors do not believe that newborns are more susceptible to this new virus than they would be to any other disease, and even if the mother was infected with COVID-19, it would not be wise to the child is separated from his mother, breastfeeding in these conditions being further encouraged by the WHO.
Ask yourself how you would feel if you were pregnant during this period. You may now feel emotionally well, and you may just want to move on with your life, even in this context. But a task could add extra stress to a situation like the one we are already experiencing, in which the uncertainty about many aspects of everyday life is overwhelming. In addition, pregnancy itself can be a difficult emotional experience, even when everything is going well, so if you are prone to anxiety disorders, postponing plans to conceive a child is probably the best solution for your mental health and emotional at this time.
Providing necessary pre- and postnatal medical care. Another thing to think about, if you are considering getting pregnant now, is whether or not the medical system will continue to be available to provide you with the necessary prenatal and postnatal care. Little is still known about the virus itself, and despite tests, it is impossible to know how many people are infected, how many people will eventually be infected, and how demanding the medical system will be in the future. Part of the problem is that no one knows how long the pandemic will last. It could be 2 or 3 months, 7 months, or even a year and a half, in the most pessimistic scenarios. What will it be like when you have to go to a hospital to give birth in 9 months? Can you tell if the birth experience will be a relaxed and safe one? At this time, we are urged to avoid hospitals if we are not in an emergency, but for pregnant women and especially for those in labor, this is simply not an option. More than ever, it would be wise to think about your own medical history. For example, if you have had complications in previous pregnancies or suffer from a chronic condition, which means that you will need additional care during pregnancy, you may conclude that now is not the right time to get pregnant.
Will coronavirus infection affect fertility later? There are currently no studies indicating that the virus has any impact on female or male fertility. Although the fears caused by coronavirus have led some women to resort to egg freezing as a preventative measure, if you become infected with coronavirus, there is no reason to worry about the chances of conceiving a baby after you heal. How can I prepare for pregnancy during self-isolation? Although you may come to the conclusion that it is better to postpone the conception of a child for the time being, this does not mean that you cannot take care of your fertility and that of your partner and prepare for the right time.
Did you know that a woman needs about 3 months to mature an egg that will be ready for ovulation every month, and a man needs about 3 months to produce a row of sperm? 3 months is the magic number, and because so many months it takes the body to completely eliminate certain toxins that limit fertility and increase the levels of essential nutrients that accelerate fertility, as well as the fact that you will need to get rid of unhealthy habits and get rid of them, change with some healthy ones. The way you both live in these 3 months, what you eat, what level of fitness you have, how much toxins you are exposed to, etc., can make a significant difference to the quality of the egg you mature and the sperm your partner's body needs produce.
If you haven't already, it's a good time to start monitoring your menstrual cycle and notice the primary signs of fertility your body emits, such as changes in your cervical mucus. If you have an irregular menstrual cycle and acute premenstrual syndrome, now is the time to start a cure for hormonal regulation and stimulation of ovulation. As with planning a pregnancy at any other time, there are plenty of things you can do to have a pregnancy and a healthy baby. 1. Quit smoking, alcohol consumption, and reduce caffeine consumption if you have these addictions. 2. Take folic acid and vitamin D. 3. Follow a healthy and balanced diet. 4. Stay active, exercise and maintain your normal weight. Any activity that increases your heart rate can help you stay fit and healthy.
It is true, there is no right time to have a child, but there are times that are better than others. After all, you, your partner, and your doctor are the only ones who can decide when the time is right to have a baby. Together you will evaluate and decide if the risk of waiting and delaying a pregnancy is greater than the risk of getting pregnant in the middle of what is happening at the moment. Keeping calm along with following the recommendations given by the authorities to limit the infection will help us all get through this period well.